The criteria for an AP knee evaluation, we first need to look for proper collimation. We need to make sure that the patient's knee is fully extended. Next, we look for no rotation by seeing that the patella is superimposed by the distal femur. Also, that femoral condyles are symmetrical on both the lateral and medial side, and that there is no superimposition of the fibular head in the proximal tibia. And finally, making sure that the joint space of the tibia and fibular are open with the interspaces of equal distance and soft tissue and bony trabeculae detail. In evaluating the AP oblique projection and medial rotation of the knee, we're looking for proper collimation. We're also looking for an open knee joint, as well as the margin of the patella sitting slightly beyond the medial side of the femoral condyle, evidence of both tibial plateaus, the lateral condyles of the femur and tibia, as well as the posterior tibia, and there is separation of the tibia and fibula at their proximal articulation, and finally soft tissue and bony trabeculae detail. To evaluate the lateral view of the knee, we need to make sure that there is proper collimation. The knee is flexed between 20 and 30 degrees, and a true lateral position demonstrates the femoral condyles are superimposed. The patella is in lateral profile. There's open joint space of the patellofemoral joint, open joint space between the femoral condyles and the tibia, and lastly, soft tissue and bony trabecular detail. The criteria for the PA axial Camp-Coventry method is first proper collimation. We also need to make sure that the intercondylar fossa space is open. There's evidence of the posterior inferior surface of the femoral condyles. The knee joint space is also open, and at least one tibial plateau is in view with superimposed anterior and posterior surfaces. The apex is not superimposing the fossa. There is no rotation, which is demonstrated by slight tibiofibular overlap and the centered intercondylar eminence. And finally, evidence of soft tissue and bony trabecular detail are in view. The criteria for the tangential projection Settegast method, we're looking for proper collimation. We're also looking that the patella is in profile and that there's evidence of the femoral condyles and the intercondylar sulcus, open joint space of the patellofemoral joint, and lastly, soft tissue and bony trabecular detail.